We're helping people in times of crises and in times of emergencies when they might be more at risk of protection issues. I'm Michelle Marteleira. I'm the Protection, Gender, Inclusion, and Engagement Specialist with the Canadian Red Cross. Protection, gender, inclusion, and engagement is really an approach that the Canadian Red Cross uses, and the whole Red Cross movement actually uses, as a way to ensure that everyone that we're serving can feel safe and protected when they're accessing Red Cross services. So if someone, for example, has a disability, we want to make sure they're always able to access our services. We're not leaving anyone behind. So we're really looking at the protection and the safety and how they intersect with inclusion. Violence in the home can increase during crises and emergencies. So if we are interacting with people, we want to make sure we're aware, we know how to make those referrals and support for people who are coming to us. If someone is fleeing domestic violence, we can also give them numbers, crisis lines, shelters, where they can get that immediate support. Also with child protection, it's really important. All of our operations can consider the rights and dignity of children, also the rights and dignity of everyone who we're supporting. One of the first things we like to do to ensure we're meeting those standards for protection, gender, and inclusion is use some of the key tools that we have. So for example, the PGIE checklist is one of those tools that we use. We go and visit a site. We'll walk through it as if we were a community member, someone who is accessing our services. We want to walk in their footsteps. We'll see if it's appropriate, if there's enough space, if there's enough privacy. We want to make sure that there are areas for children where kids can have access to coloring books and crayons. Are there places for nursing mothers to nurse? Are there places for elders? So we've been looking at how we can accommodate that at this site. And then we also have a resource table with some of our key referrals. So we'll have information from other local community organizations, mental health supports, crisis lines. And so we try to make that all available for people who are coming to the site so they know that there is longer-term support. We have some volunteers who are trained in making those referrals. So if they're talking to people in the registration process, they can really identify if there are greater needs and then make a referral with them so they can access those supports directly. For us, the process for PGIE now is to formalize those standards across the country. We're really looking at things more thoughtfully. We're adding an Indigenous lens where needed. We're looking at different needs, the context of different local communities, but always ensuring that every operation that we have does consider protection, gender, inclusion, and engagement.